Hey guys, so if you're watching this video, you have just received your temporary veneers. So I just want to go over a few things with you so you know how to take care of them the next 3 to 4 weeks. The most important thing is I don't want you to eat any food with your front teeth, okay? So you are doing soft foods until you come back and get your permanent veneers. And by soft foods, I mean like scrambled eggs, protein drinks, yogurt, pudding, soups, that type of thing. You will get fairly tired of those type of foods by the time you come back, but it's really important that you don't try to bite through anything with those front teeth. I've also made you a night guard that will fit nicely over these temporary veneers. I want you to wear that every single night, okay? So our biggest concern is that we don't chip or break off these temporary veneers, especially if you live out of state. If you do live out of state, I've sent you with a matrix that any dentist can use to put a temporary veneer back in place. If you live in state and you have a temporary veneer pop off or you chip or break something, just give me a call and we'll take care of that for you. The temporary veneers, they can stain quite easily actually to foods that have a lot of food coloring in them, okay? So red wine, coffee, anything with strong food coloring that's like red or pink can stain quite easily. So you want to avoid those. If you want to drink coffee, just drink it through a straw. It's no big deal. A lot of my patients do that and that tends to work out just fine. So the point is, be very, very careful with them when you eat food. If it's not really, really soft, cut it up, put it way in the back and chew it with your back teeth. Make sure you wear that night guard every single night. Your teeth are gonna be a little bit sensitive for the first 2 or 3 days. It shouldn't be a big deal. If you're having a lot of sensitivity, you definitely want to give me a call, okay? Your gums also will be sensitive for the first like 48 hours, okay? Your teeth sometimes they can be sensitive the entire 3 or 4 weeks, but again, it's usually very, very minor. Once your permanent veneers go on, that sensitivity is gonna go away really quickly. As far as care for your temporary veneers goes, I want you to brush them just as you would brush your normal teeth, but you won't be able to floss them because the temporary veneers are all one piece. So I want you to floss all the rest of your teeth just as normal, but the veneers, the temporary veneers, you can't floss them. So what I want you to do instead is we have given you a syringe with a little point on it. So I want you to fill that up, half water, half hydrogen peroxide, and every night you're gonna blast around your gum line from the front and from the back. And that's gonna keep your gums nice and healthy. So make sure you do that at least once a day, preferably at night right before you go to bed. For the sensitivity, the first couple days, if it's bothering you, you could do like 2 ibuprofen and 1 Tylenol, or maybe 1 and 1, depending on how much it's bothering you. That typically will take care of whatever sensitivity you're having. If you have some high spots still after you leave, if you live in state, give me a call and come back in and see me. We'll make a quick adjustment for you. If you live out of state and you feel like you do have a high spot somewhere, you could call your dentist and he'd be able to make an adjustment for you. So overall, I'm super excited you came in to see me. I hope you love your temporary veneers and I can't wait to get your permanent veneers in.